Ontario has once again implemented stricter public health restrictions as Omicron spreads at an alarming rate. Capacity limits and caps on social gatherings are back in effect right before the holidays. But there are a lot of questions about the rationale. For more on this and other COVID headlines, infectious disease specialist Dr. Isaac Bogoch joins us now. Good morning, Dr. Bogoch. Thanks for joining us.
My pleasure. Good to see you, Candace.
You too. So, I don't want to say make this make sense, but tell us where our thinking went wrong, because many people were under the impression that even though cases were rising, hospitalizations were staying steady, and that was the kind of key number that we had to watch. So what triggered this kind of rapid, massive response, and do you think it's the right call?
Yeah, so, it's fair to say that we don't know enough about this variant of concern. We know a lot more than we did a few weeks ago, but there's still a lot of unknowns. It's pretty clear that cases are skyrocketing in Ontario. We had one of the highest case counts ever, and that's expected to continue to rise. I think that Dr. Moore, the Chief Medical Officer of Health, was appropriately concerned here. We have a very fragile healthcare system right now. There's been significant attrition over the last 18 months because who can blame healthcare workers for leaving? It's been challenging, to put it politely. So we're in a very fragile place. So even if a very small percentage of those cases need hospitalization or ICU care, a small percentage of a massive number of people still ends up being a lot of people that require hospitalization and ICU care. And I think all the models point in the direction that we could be significantly stretched. So this was an attempt to at least slow this down, to buy time to get vaccines in, get rapid tests out, and bolster healthcare capacity. Will it work? I honestly don't know. I don't. And those are tough political and public health decisions. Obviously, we all hope it does work, but nobody likes this. I think it's fair to say that it obviously comes with significant detriments, right? Holiday gatherings, financial, social, psychological well-being. These are all issues. And the hope obviously is that we can protect the integrity of our healthcare system so we can care for the population of Ontario.
And, we also saw the lineups at Yorkdale and at the LCBOs last week for rapid tests. So definitely the demand is there, and there is more access now in this province. What's the best way to utilize them, especially when we're talking about timing? Would you use it before or after a get-together?
Definitely before.
Okay.
Before you have a small get-together, if everyone has a rapid test and tests negative, half hour or so before you go, or before you leave the door to go to the whatever event you're going to, if everybody does it and tests negative, you have an added layer of protection. It's not perfect. I think people have to recognize this. It's not perfect. It's just really good. And it's a layer of protection in addition to vaccination, better ventilated rooms. Obviously, people aren't going to be wearing masks if you're sitting down to eat, but we know masks are also helpful if you're not in a place where you're having dinner with each other.
Okay, and as it spreads at an unprecedented rate and exposure becomes more of an issue, how do we do this personal risk assessment that is now being touted as the measure to determine whether you go somewhere or don't go somewhere? So what would be the tenets of that personal risk assessment?
It's obviously pretty individual, and we don't all come from the same place. Some people might be more vulnerable to infection and more vulnerable to severe infection, or live with someone who is. I think it's just fair to say that we have some tools to help keep ourselves safe and to keep those around us safe. Keep gatherings as small as you can. Doesn't mean cancel Christmas or cancel the holidays. It just means keep your gathering small. Be mindful of who's there. If you're not vaccinated, it's a perfect time to do it. It's not like the vaccines don't work. They still do. 3 doses is better than 2, but 2 still works to prevent, looks like they work to actually rather well to prevent severe illness. Better ventilated rooms. We have the tools, but of course we just have to be mindful that there's a lot of COVID out there, and not nice to talk about again, but there's going to be more of this in the near future. It's sadly getting worse, not better, over the coming days and the coming few weeks ahead.
And before we run out of time, I want to end on kids, I guess. For children 5 to 11, the guideline is to wait 8 weeks between doses, but parents can consent to a shorter interval. What guidance do you have for parents looking to make that decision?
Obviously, we have to consider that kids just don't get as sick as adults. We don't want kids to get this, but they just don't get as sick as older populations. the vaccines appear to be very effective in kids, although I haven't seen data with Omicron. It still is likely to reduce the risk of infection and severe infection. Listen, I'm inclined to listen to the vaccine experts who said separate doses by at least 8 weeks to reduce the risk of myocarditis, which appears to be a low risk in kids, but also to mount a more robust immune response. So I'm going to adhere to the advice of NACI on this one.
Okay, thanks as always. That's infectious disease specialist Dr. Isaac Bogoch. Happy holidays to you too.
You as well.